We can, okay. Yes, and then I'm waiting the audience, but you can now start.
Hi, Halim. Thank you for joining us today.
Hello.
Hi, Ladi. How are you?
Hi, Dr. Morante. Good. How are you?
I'm good. Hello, everyone, and welcome to PMHNP Would You Pass? Lock It Live with Pass Review Center and Lock It In. We are so excited to have you here.
Hello, everyone. My name is Letty. I'm a board certified PMHNP, and I'm here to help you. I'm a new faculty for Pass Review. I'm so glad to see everyone here today.
Great. Tonight, we are going to strengthen your clinical judgment, sharpen your test taking skills, and build the confidence you need to walk into your PMHNP boards prep. And we are so focused on doing this. Okay. So this is not just a review session, but this is our opportunity to lock in your knowledge, identify your weak areas, and practice thinking like a board-ready psychiatric mental health nurse practitioner. So during this session, we will go through board-style questions and break down answer choices and review clinical concepts and highlight the tropes that often show up on the exam day. And Letty,
Yes, so we are going to have 10 questions today, and we're going to
yeah,
break down every choices. Why that is the answer. And I just took the boards. I have taken several board exams, and I've taken it only once. So I would say I'm probably one of the best resource when doing like test taking strategies. Um, you will notice on your boards, you're going to have 25 questions, which will not be scored, and you might find it really hard. So don't panic because we're here to guide you and help you pass your board exam in one take.
that's great. We also need to make sure we control our test anxiety. Once you come into the testing center, which is Prometric, and you should be able to be prepared for any questions that you can throw you off. And that's basically being prepared with all the domains of the exam and knowing the blueprint and knowing your strengths and weakness is very important. So we'll start. And thank you for all those who are tuning in live. Please make sure to type in your name and where you're coming from and how did you hear about us. That's very important. So just a reminder, upon successful completion of our CEU activity today, which is 1 hour, make sure you are registered for this activity and sign in to receive a full contact hour credit at the start of the program. You must be present no later than 5 minutes after the start of the educational activity and attend the entire activity. And you must complete the evaluation at the conclusion of the program. So once again, the disclosure, this activity is provided by Pass Review Center. No speaker or planner has identified a conflict of interest related to these activities. No commercial support has been provided for educational activity. Neither ANCC or PASS endorse any commercial products discussed and displayed in conjunction with this educational activity.
All right, so before we proceed, I want everyone to put on their nurse practitioner hat. Okay, you are a Psych NP hat. You are a Psych NP. You are not a registered nurse. You are not primary care nurse practitioner, but you are a psychiatric nurse practitioner. So whenever you're answering questions, think like one, because the boards will test you if you are a safe psychiatric nurse practitioner. All right, so let's start with the first question. This was posted already, and some of you have conflicting answers, and I'm gonna guide you and explain to you why exactly that choice is the right answer. A 46-year-old patient presents for evaluation and treatment of alcohol use disorder. During the intake assessment, the PMHNP notes that the patient has a history of chronic hepatitis C with elevated liver enzymes, but no evidence of acute liver failure at this time. Which of the following medications is most contraindicated or should not be avoided due to the patient's hepatic impairment? A. Disulfiram or antabuse. B, lorazepam or Ativan, C, naltrexone or Vivitrol, D, acamprosate Compral. By just looking at the multiple choices, you can easily eliminate one. What is it? It's going to be B is already eliminated. Why? We only give Ativan to patients who are in acute withdrawal. So that's already eliminated. D can be eliminated, acamprosate. Why? It is only used when the patient is to maintain abstinence from drinking alcohol. So it's only given when they have stopped drinking. Remember, look at your keywords. It is during the intake assessment. Another keyword that would you look at is has a history of chronic hepatitis C. Many of you got confused and answered C, naltrexone. No, we don't give Vivitrol to patients because it says here that this patient doesn't have evidence of acute liver failure at this time. So what is the answer? It's going to be, next slide, please. The answer will be antabuse. Right, so the mechanism of antabuse, it inhibits aldehyde dehydrogenase that can cause acetaldehyde buildup when alcohol is consumed. So the key issue here is hepatotoxicity risk. So it can cause severe liver injury and fulminant hepatitis. Because what happens when you have hepatitis? It has inflammation. So that's why antabuse is really contraindicated and heavily advised against hepatitis C. So if you look at on one side of our slide, we created here a mnemonic post for you. So remember, for antabuse, you always have to avoid alcohol, not just alcohol from your beer or drinking alcohol, but you also have to educate your patient to look into the products that they're taking. One very common example of products that we use every day is the mouthwash. So you have to educate your patient to look at the ingredients of everything that they use to and make sure that they avoid alcohol. Okay, number 2. A 7-year-old patient with sickle cell disease was brought to the clinic for externalizing behaviors. He has history of several admissions due to sickle cell crisis, and the patients are seeking advice from you. As a PMHNP, what is your recommendation? Remember, from the start of our session, I said, put on your psychiatric mental health nurse practitioner hat. You are not a primary care nurse practitioner. So, first choice, letter A, refer for treatment for sickle cell. Maybe. B, promote individualism and independence. C, encourage to increase oral fluid intake. D, support homeschooling. Let's go back to the question. The keywords are a 7-year-old. Whenever you see age, you think developmental stages, Piaget or Erik Erikson. The word sickle cell disease, that is just a nuisance. But if you look into this, what are your main responsibility as a PMHNP? So the answer will be letter B, promote individualism and independence. So think of Erik Erikson's developmental stage first. So school age, 6 to 12 years, it's industry versus inferiority. So what do you have to foster? You have to promote independence, competence, achievement, and peer interaction. That's why D is not the answer. Do not support homeschooling because you want to promote peer interaction. Encourage to increase oral fluid intake. Dehydration can cause sickle cell disease, but remember, you are a psych NP, so you have to stay on your lane. So on the other side of the, on one side of our slides, we have here the mnemonic for developmental stages. I really do advise, we all have different ways of learning. I created my own mnemonics, and then this one is highly recommended to everyone. So we're making things easier for you. So we already created this mnemonics for you guys. All right. So the first stages of Erik Erikson, this is just a review. Trust versus mistrust. From 0 to 1 year old. From 1 to 3 years old, autonomy versus shame and doubt. I lost the slide. And then I'm sorry. And then from 3 to 6, initiative versus skill. 6 to 12, industry versus inferiority. 12 to 18 years old, identity versus role confusion. Our teenagers, it's a big thing. It's heavily tested on the board exam. Young adulthood, intimacy versus isolation, middle adulthood, generativity versus stagnation, and then older adulthood, integrity versus despair. This stage, integrity versus despair, is also heavily tested in the board exam. Next.
Thank you, Letty. And we just want to add some pertinent information, like in terms of Eric Erickson. Make sure, guys, you know your how Poku fooled the cow. We're talking about hope, will, purpose, competence, fidelity, love, care, and wisdom. So it follows the same thing, right? Trust is hope, autonomy is will, initiative is purpose, industry is competence, identity is your fidelity, love is your intimacy, generativity is care, and then integrity is wisdom. So make sure you guys know the positive and the negative growth and development according to Eric Erickson. Okay, don't forget about that.
Okay, next question. So, the 38-year-old patient with major depressive disorder has been stable on Cymbalta for 6 months. During a follow-up visit, he reports smoking 1 pack of cigarettes daily. The PMHNP understands that the components of cigarette smoke induce the CYP1A2 enzyme. Which of the following best describes the role of nicotine smoking in relation to duloxetine therapy? Okay. First choice, letter A, smoking inhibits CYP1A2, causing increased duloxetine levels and toxicity. B, smoking induces CYP1A2, increasing duloxetine metabolism and potentially reducing its effectiveness. C, smoking has no effect on duloxetine because duloxetine is metabolized exclusively by CYP3A4. And D, smoking increases duloxetine absorption from the GI tract, leading to higher serum concentrations. Okay, let's think that you forgot what is CYP1A2 and what it does, right? If you're like me who's allergic to numbers and letters combination, how am I gonna look at this question? Test taking strategy. I don't know what is CYP1A2. I forgot about the duloxetine because I'm so anxious. But you can still answer this question. You look at the multiple choices. There are 2 options that are opposing. The likelihood one of those answers is correct is very, very high. So if you look at the multiple choices A and B, they are contraindicating for, or they're like opposite each other. So the answer would be letter B. Smoking induces CYP1A2, increasing duloxetine metabolism and potentially reducing its effectiveness. This is very important. Cigarette smoke, not the nicotine itself actually, but the polycyclic aromatic hydrocarbons in tobacco smoke induces CYP1A2 activity, which can increase the metabolism of duloxetine. So as a result, serum concentrations may decrease, potentially reducing the antidepressant's therapeutic effect. As a PMHNP, what would be your main responsibility? When patients tell you that, oh, I started smoking, what are you going to do? When patients are taking these kinds of medications, you have to increase their dose. If the patients tell you, oh, you know what, I forgot, I'm in the smoking cessation program, what are you going to do? You are going to decrease the dose of this medication. So aside from Cymbalta, there are other medications that you have to master because this is very important and it's also tested on the board exam. On my board exam, what came out was olanzapine. And then it asked me about the CYP1A2. So remember, doc takes care. So D stands for duloxetine, O olanzapine, C for clozapine, T for theophylline, and C for caffeine. If patients are taking this, taking these medications and they're also smoking, you have to increase their dose.
Thank you, Letty. And just make sure that smoking speeds Cymbalta out. So if you stop smoking, the levels go higher than usual. The same thing when you're taking olanzapine, right? You're more psychotic than usual, then you need to make sure that you need to discuss smoking cessation, or else they're going to be more psychotic and seeing things or hearing things. But
Mhm.
once they stop smoking and they're on olanzapine, then that's a time wherein we can taper the dose slowly. Just remember, nicotine is an inducer. It brings down the medication.
Next question. Number 4, a patient diagnosed with schizophrenia is taking olanzapine. As a PMHNP, you review the patient's lab results. Which finding would most likely require you to consider holding the medication or further evaluating treatment safety? This question tests you if you know your normal lab values. But say, for example, you forgot because you're in panic, you're having anxiety during the boards. Look at the multiple choices. So our options are A, ANC of 2,500, B, WBC of 12,000, C, platelet count of 150,000, D, ANC of 800. Again, you look at the multiple choices and you're like, there are two options with the same lab values, and they are opposite than each other. One is low, one is high. So you have chances are one of those options will be the right answer. So what will be your answer? It's letter D, ANC of 800. So although olanzapine is less commonly associated with agranulocytosis compared to clozapine, it can still rarely cause leukopenia and neutropenia. So your lab, especially your CBC, has to be monitored. So may be clinically relevant when concerns arise. So remember, when it's 8, it's too late. So you have to evaluate. So that's a good rhyme. I like that. So if your lab values of your ANC is at 1,500, the patient's safe, not in danger zone. If it's like at about 1,000 to 1,500, you'll be like a little concerned. So you're going to start monitoring your lab values. And then you have to also educate your patient about what to watch out for, the signs and symptoms, like fever, body malaise, when they have like throat rash. So if it's less than 1,000, we have a concern. And then when it's 800, you have to stop your medication right away and send the patient to the hospital to be evaluated. Okay, number 8. Okay, so for those who are joining us on Facebook, YouTube, Instagram, and LinkedIn, if you haven't registered yet, this session you can get CEUs from it, but you have to make sure that you have to register, okay? So you go ahead and scan the QR code on your screen. Registration is required to be eligible for a raffle drawing and at the end of today's session. You don't miss this chance to win. Scan, register, and join. And also, please stay towards the end of our session because you also have to do the evaluation to get your CEUs. So remember, you have to register, stay during the session, and at the same time, towards the end, do the evaluation to get your CEUs for this session. This is free, guys. It's free CEU. Okay, question number 5. A 74-year-old female is brought to the clinic because her daughter is concerned she may be developing Alzheimer's disease. You are educating them about the expected brain changes associated with Alzheimer's disease. Which statement best describes the pathophysiology of Alzheimer's disease? This question will test you of your knowledge about anatomy and physiology. All right, so letter A, there is a decrease in dopamine production leading to progressive motor symptoms and cognitive decline. Is it Alzheimer's? It's dopamine and motor, you'll think? Okay, we'll talk more about that. B, there is an accumulation of beta amyloid plaques outside neurons and tau protein tangles inside neurons, leading to neuronal death and brain atrophy. C, there is demyelination of neurons in the central nervous system, causing slow nerve conduction and memory loss. And D, there is reversible swelling of brain tissue due to infection, causing temporary confusion and memory impairment. So this is testing you what your knowledge is with, common diagnosis among our geriatric patients. So what is the answer? The answer would be It's letter B. Why? Because letter A, it talks about Parkinson's disease. It talks about motor. It talks about dopamine. Letter C, it's MS, multiple sclerosis. The key word there is demyelination. So if you see demyelination, it's probably multiple sclerosis. And then D is swelling, infection, probably encephalitis. So Alzheimer's disease is characterized with buildup of beta amyloid plaques and tau fibrillary tangles. So remember tau and beta amyloid. These abnormalities cause synaptic dysfunction, neuronal loss, especially in the hippocampus, and ultimately lead to global brain atrophy and cognitive decline. Remember, hippocampus, what is in your hippocampus? What is hippocampus responsible for? Your memory, okay? So we have here the mnemonics for Alzheimer's. So use each letter to remember the hallmark features. Say A, it affects their activities of daily living. Your patient or their family would say, no, before they used to like cook, now they can't do this anymore. Language problems. They would have like word finding. They'll be like in the middle of a sentence. They're like, I don't remember. I'm trying to find the right words, but I couldn't say it. Z, zones becomes confusing, can get lost in familiar places. H, hard to learn new information. Recent memory is really affected first. Executive function decreases, so poor planning, judgment, they can't organize their days anymore. Insidious onset, so it is slow. Progressive decline, it is not abrupt. If it's abrupt, it's something else. Memory loss, so this is a classic and early symptom of Alzheimer's. Emotional or personality changes, so may show anxiety, depression, or agitation. And then repeats questions or stories all the time. You're gonna hear the same stories from the 1960s, the 1940s. So they forget recent communication or recent discussions with people. And then finally, sundowning and safety concerns. So during a time, they get confused. So sometimes they wonder, so what is important here is to provide safety.
And that's very important. We also need to assess the executive functioning of the patient, and we need to make sure we differentiate different types of dementia. So there's difference between a vascular dementia, Alzheimer's disease, and also your Lewy body dementia, wherein they have visual hallucinations. While after having stroke or heart attack, and now or they develop like a vascular dementia. And then remember hippocampus. That's how I remember it. Hippopotamus. If you see a hippopotamus, then it goes to your memory, right?
Yeah.
So hippocampus, hippopotamus, memory cells. Okay.
Oh, I think I got like 5 similar questions to this. So I got 5 cultural questions. So a patient of Asian descent is experiencing a psychotic episode and reports having a wind cold illness. What is the most appropriate initial response by the PMHNP? If you are an Asian provider, it will be easy for you, but what if you're not? So when you see a quote and quote on the question, think this is probably cultural. When you see a word that you are not familiar, not in English, the question is probably cultural. So, what are options? Give an antipsychotic medication immediately? No, of course not. Not right away. B, tell me more about how you feel. C, encourage the family to admit the patient for schizophrenia treatment right away. D, reassure the patient that there is no cold wind in the room. So the answer is quite obvious. It's letter B. Tell me more about how you feel. This is a good response by a psych NP. Why? You don't understand what the patient is actually saying. So you have to ask more. By asking an open-ended question, you are initiating a therapeutic communication. So you have to have them express and ask them exactly what does it mean? What does wind cold illness mean? So the patient is expressing symptoms using a cultural explanation of distress, so which may reflect traditional beliefs. So in the Asian culture, wind and cold illness is like yin yang, the imbalance of the yin yang. So the priority is to assess the meaning, build rapport, and avoid confrontation or dismissal of beliefs. So room one is room one. Well, choice A is not the right answer because you don't want to give the patient treatment right away. Room three, you do not admit patient just because they tell you about something that you're not familiar with. And room four, reassure that the patient that there is no wind and cold in the room is invalidating the patient's concerns. So what's going to happen? Your patient will think that you're not listening to them. So next thing you know, they cancel their appointment. So you lost a patient.
Knowledge on your culture is very important. We need to make sure we build a therapeutic alliance to our patients. Culture is not to memorize every culture. It is more like how do you provide safe, respectful, individualized psychiatric care without stereotyping your patients. So most likely correct answer language that you need to make sure to remember is that tell me what this means to you. How does your culture or faith influence your treatment preferences? Or use a certified medical interpreter and assess the patient's explanatory model of illness. So we really need to be culturally sensitive at all times as a psych nurse practitioner.
All right, next question.
Right.
So, a 4-year-old patient is showing signs concerning for possible sexual abuse. What is the nurse practitioner's primary intervention? This is heavily tested on the board, and I got this question on mine. So, again, think that you are a psychiatric nurse practitioner and always stay on your lane. Letter A, talk to the mother before considering reporting. Do you have to? Letter B, perform a physical examination to confirm abuse. Is that part of your description as a psych NP? Letter C, report to Child Protective Services. Letter D, complete the assessment and reassess in 1 week. Answer is letter C. So healthcare providers are mandated reporters. Each state has a different timeline on when you can submit the paperwork, but this has to be reported right away. Where there is a reasonable suspicion of child abuse, the priority is to report to CPS immediately. You do not need to have proof of confirmation before reporting. So this ensures that this would be immediately protect the child, initiation of formal investigation, and coordination with child advocacy and forensic services. Again, regardless of what states we are all mandated, okay? You do not touch the patient because that is not your specialty. Do not tamper the evidence. So what you're gonna do, you report to CPS.
Thank you, Letty. I just also wanted to emphasize about ensuring immediate safety for the patient, assess for medical emergency or acute danger. We always need to report suspected child abuse to CPS, document objectively, and we also need to use a trauma informed care for our patient. Avoid leading or repeated questioning. So do not pick answers like continue therapy and monitor. Ask the parent to explain. Confront the suspected abuser. Wait until the child confirms the story. Or promise the child that you will not tell everyone. So, our best language will be I am concerned about your safety and have to report this to help protect you. So, for children, the keyword is suspected abuse. You are not the detective. You are the mandated reporter. Always remember that. For adults, it may be different. Adult sexual assault usually involves patient consent, autonomy, safety planning, and making sure we do our STI or pregnancy care and trauma informed support unless the adult is vulnerable, disabled, elderly, or there is an immediate safety or legal reporting requirement. So when abuse shows up, do not jump to medication or psychotherapy first. Ask if someone is unsafe. Is this child? Do I have a duty to report it? And always remember safety is a priority on the exam. Wherever you go, safety is number one.
Correct. So we're up we're close to our last questions. Does anybody have any questions right now before we proceed?
Yeah, I think a lot of our audience are typing in their answers into the chat box. So thank you. Like Addie
Thank you.
TL, she answered letter C. So thank you for that. And do
Thank
not
you.
hesitate to share, tag, or send this to somebody who is taking their board exam really soon or somebody that can benefit from the psychiatric concepts that we're presenting today.
Oh, I think I remembered something. I think I got two similar questions about this. There will be an option saying like leave the child with a mom in the room. So that would be a wrong answer too. Okay. All right. Next question. A 20-year-old patient presents to the clinic with complaints of persistent anxiety, fatigue, poor appetite, and feeling like my soul left my body after witnessing a traumatic car accident. The patient explains that in her culture, this condition is called susto. As the PMHNP, what is the most appropriate interpretation of this presentation? Remember what I said? Anything that is quote unquote, probably the question is cultural. So choice letter A, the patient is experiencing a primary psychotic disorder and requires immediate antipsychotic treatment right away. Probably not. B, the patient is describing a culturally recognized syndrome of distress related to trauma and anxiety. C, the patient is malingering symptoms for secondary gain. D, the patient is experiencing a dissociative identity disorder. So, what do you think is the answer?
Type in
All
your
right.
answer. Some of them answered letter D, B, or D. So remember, I always follow the 2-2-1 ruling when I take my exam. In a multiple choice question, there's always two distractors. And
Mm-hmm.
between those two potential answers, I always choose the best answer.
Mm-hmm.
So always remember that there is two distractors and two potential answers. So 2-2-1 ruling.
Okay. The answer is letter B. So the patient is describing a culturally recognized syndrome of distress related to trauma and anxiety. So without even you knowing what susto means, you can still get the answer. Why? Because you are not going to um, say that since the patient is telling something that you're not familiar with, that they're already psychotic, right? You need to have more assessment. More assessment. So you don't give immediately antipsychotic treatment, right? So susto is a cultural syndrome commonly described in Latin American cultures, often translated as fright or soul loss. It is associated with exposure to a traumatic or frightening event and may present with anxiety, somatic symptoms, insomnia, fatigue, and depressive features. It is not considered a primary psychotic or dissociative identity disorder. The appropriate clinical approach is to first recognize that this is a cultural explanation of distress. Conduct a full psychiatric assessment, provide a trauma informed and culturally sensitive care. When is this going to be a problem? When this becomes chronic. And then it's also associated with other symptoms. Um, so susto means we have some mnemonic here. Susto is scared soul. So use this cues to remember, okay? So it's a scary event. It's unexplained physical symptoms. They feel like they lost their souls. It is usually triggered by a traumatic event. And then finally, you have to observe the cultural context. So not every unusual belief that the patient tell you is a symptom of a psychotic disorder. So what you have to do, you have to assess further.
Very good. Always remember that when we're answering questions like this, like you need to be open-ended questions. Like, can you tell me what susto means to you and how you believe it should be treated? Or how does your cultural understanding of the illness affect your symptoms and treatment preferences? So we always need to avoid answers that say, educate the patient that susto is not real. That's
Mm-hmm.
invalidating your patient.
Mm-hmm.
Telling your patient that the patient is has depression or dismissing the cultural belief or immediately prescribing medication only, words with only, never, none, all. Those are
Mhm.
options that limit the options, or refer only to a spiritual healer and avoid
Healer.
psychiatric evaluation. So that's also another board exam trap. So for culture questions, guys, pick the answer that says as, assess the meaning, respect the belief, integrate safe cultural practices, and screen for DSM-5 symptoms. You always want to go back to your nursing process. Assess, diagnose, plan,
Um,
implement, evaluate. ADPI is always going to be your formula in passing the board exam.
Yes, correct. So we have a couple of audience here. They got the answer right. And if you join us for our next review sessions, I'm gonna share more. I remembered a lot on my board exam. Right after I took it, I took out my phone and then because I got the results right away while I was like walking out of the testing center. I remembered so many questions and I had remembered another one. This question triggered me to remember about a Native American question about like, counselors and then healers, but we're gonna leave it for our next session, so we have something to talk about next sessions. Okay, and now we're up to our ninth question. So a 19-year-old patient with bipolar disorder is taking lithium. She tells you she's going on a 1 week long Girl Scout camping trip. What is the most appropriate teaching point? A. Bring a canteen with extra water and maintain adequate hydration. B. Stop lithium during the camping trip to prevent toxicity. C. Restrict salt intake to prevent fluid retention. And then D. Avoid all physical activity while taking lithium. Please comment your answers. Remember, what are keywords? Bipolar disorder, that is taking lithium, and she's going to our Girl Scout camping trip. What happens during camping trip? There's a lot of activities. There will be sun exposure. Okay, and the answer is letter A. Bring a canteen with extra water and maintain adequate hydration. Good job. Karen, Heidi, Isata, Adi, Deepika, and Jahid. Good
Yes.
job. So, lithium is excreted by the kidneys and its level is highly sensitive to hydration status and sodium balance. So, dehydration can be caused by heat, exercise, or limited fluid access during camping. So, it can increase lithium levels and lead to toxicity. So, your key teaching point is to include maintain adequate hydration, especially during hot environments. Camping trip is an example, or they say they were going to go to a desert party or going to a festival, or a question could throw in, oh, your patient's going to Coachella. What happens there? It's so hot. Avoid dehydration from sweating, diarrhea, or vomiting. If the patients tell you, oh, I'm having like diarrhea, I'm having like vomiting, you have to monitor their lithium levels. Monitor for signs of lithium toxicity. You have to educate them what to watch out for. This is very important. Part of our responsibilities as provider is to make sure that we educate our patients on what to watch out for, especially for like medications like lithium with very short therapeutic index. So tremor, confusion, ataxia, and GI upset. Those are your signs of lithium toxicity. Keep sodium intake consistently, so not restricted or excessive changes. The board exam will also test you and give you signs and symptoms, and you have to recognize what will be your priority intervention or your priority as a PMHNP. Lithium is heavily tested on the board exam. You also have to know your um, normal levels for lithium. Okay? Any questions
Thank
for
you.
now?
Thank you, Professor Laddy. Just to piggyback, also lithium toxicity increases the risk with dehydration. That's the first risk factor that we're looking at here. Sodium depletion. We know that the sodium level normal is 135 to 145. Renal impairment and medications that affect kidney function. So we have your NSAIDs, your ACE inhibitors. They usually end with pril, captopril, lisinopril, and basically diuretics like your Lasix or furosemide 2. So all the time when there's toxicity, we have to hold the lithium and check the lithium level, renal function, and electrolytes. Always assess for toxicity and encourage fluids as appropriate. So, if the symptoms though are moderate to severe, like confusion, ataxia, severe vomiting, diarrhea, or seizure, this is urgent and emergency evaluation. So, if we're seeing them in our outpatient practice in the clinic, we always need to arrange hospitalization for the patient. And when we're taking lithium, maintain a consistent fluid and salt intake. Avoid dehydration, especially during heat, exercise, vomiting, diarrhea, and poor oral intake. So just remember the memory: no water on the hike, lithium levels spike. So once again,
Mhm.
no water on the hike will make your lithium levels spike.
All right. Shout out to Glenda Ping from for joining us from LinkedIn.
Wow. Thank you. This is amazing.
So just to remind everyone, please scan the QR code to win the raffle and get free study guide materials. So Past Review came up with a really good study material. So I was also a student of Past Review before. So I really enjoyed like the graphics. It's so easy to remember. So please go ahead and subscribe to our newsletter so you can get the free study guide materials too. And also follow us on LinkedIn, Instagram, Facebook. So, because we send out like different practice questions for you to remember. And then, as a former test taker too, I would recommend, if you have study materials, at least 100 questions. I took the board exam with only 5 days of preparation, but I aced it in one take because I was prepared. And also, you really have to hone your test taking. So, 100 questions every day until you take your board exam. And also, just not answer the questions. You also have to make sure that you look at the rationale why that is the answer. And that would actually also help you when you become providers later on.
I definitely agree with you, Lady. So we created a PMHNP learning package, and at the same time, we are officially launching our first book. So if you guys check out on our website, we have over 50 plus sales already for our first book on its first week. So we wanted to create a shout out and support to all those who have bought it already. So this is a 400 pages, all the mnemonics, all the things that you need to remember, and PMHNP mastery. It's worth an investment. You could even use it for your clinical practice, so not just for your boards. So on top of this, also we have the review modules that we have, Rise with Pass, and then also if you like clinical concepts with Master Feel. So both of this or these three books are available already in our website. And thank you for those who have supported the book and have left a good feedback on it. So thank you so much. And Letty, this is amazing.
Yes, yes.
Amazing collab.
Before when I was a student, I was so stressed out because you have to read like thousands. And I was actually coming up with my own to guide me as a new grad, like as a new grad provider. And this actually is a perfect material to have to guide you when you're like starting your practice. Because it breaks down everything and it only mentions what is important, how to diagnose, what are the DSM-5 TR criteria that meets this diagnosis, what are your monitoring labs? Those are very important. Prescribing pearls. If the patient is having bruxism and also already taking an SSRI, what else can you give? Those things, that is actually also tested in the board exam. So please join our next live. We are available on Facebook, Instagram, YouTube, and LinkedIn. But I do really recommend for everyone to subscribe, follow, so you can get updates. We're very active on our social media. Use the coupon code for the $10 discount if you want to purchase this material. And this is only exclusive for those who are joining us today. So grab that opportunity. Hey, it's $10. The economy
Great,
is tight
Professor
right
Letty.
now.
And we're also offering like a group last minute prep classes. If you wanted to go over the different domains, domain 1, 2, 3, 4, and 5, the no fluff review. So you're gonna be given the most important tools that you need, which is test taking strategies, breaking down questions, and also how to manage your test anxiety. So we'll do a group live class for that one. We will be
Mhm.
announcing it on our website. And please do not forget to like, share, subscribe, or tag your classmates who are taking the boards very soon. We're here to support you guys and pass your exam. Even if this is your
Yes.
first time, second time, or third time, we're here to guide you all throughout the process. And we want to make it as smooth as possible for you.
Yes. So someone made a comment, subscribe form on webpage for newsletter says it doesn't exist. We're gonna have someone to, oh sorry, it's 10%, not $10. So for those who are here joining us today, the discount is 10%. So use the
Yes,
coupon code PASS10. All right. And then
great.
so we're gonna fix that.
Yes, I think you guys can subscribe to the newsletter. Just fill out the jot form there. So www.passnp.com.
Okay.
So we have help out a lot of students from East Coast, West Coast, and even international students. We also have NCLEX review, FNP reviews, Psych NP review, BLS, ACLS Pulse. We are one-stop shop CU provider approved by the Board of Registered Nursing. And also, we offer different classes, free events, and
Mhm.
on-site classes that we guys, if you guys want to partner with us, if you are listening in and you're a school, we're also open to school partnership or institutional partnership with you. Thank you.
Yeah, so we are showing again the QR codes. We're going to give you some time to scan it. And also remember, you have to register and also do the evaluation to earn your CEUs.
Great. All right, I would like to extend my thank you to all the attendees today. And we make sure that we're going to do this more and more. This is our first one, and I think we were able to pull it off, all right? Hmm.
It's
So it's
www.passnp.com.
all right. I'll
Okay.
put it into the chat box too.
Last question. Okay,
Last
it's there.
question for today. Mhm.
All right, shall we proceed? All right, on our last question. An 18-week pregnant patient presents with opioid use disorder. She reports daily heroin use and is seeking treatment. What is the best medication assisted treatment during pregnancy? I was able to ace this question right away because I was a labor and delivery nurse and I've
Mhm.
encountered patients like this. So I know exactly what would be the treatment. A. Naltrexone. B. Methadone. C. Clonidine. D. Naloxone. What is the answer? I'm going to give you time to type in your answer on the chat box. Please type in your answer. Remember, 18 weeks that presents with opioid use disorder. She reports daily heroin use and is seeking treatment. What is the best medication assisted treatment during pregnancy? Okay, we have varying answers. Okay. So actually the answer is letter B, methadone. So for opioid use disorder in pregnancy, the recommended first-line treatment is opioid agonist therapy, most commonly known as methadone or buprenorphine as an alternative. For buprenorphine, you have to remember you have to do your COWS before you can give buprenorphine. So for methadone, it prevents withdrawal symptoms and cravings. It stabilizes maternal opioid levels, reduces risk of relapse, fetal distress, preterm birth, and miscarriages. So it is well studied and considered safe in pregnancy under supervision. So this is also approved by the American College of Obstetrics and Gynecology treatment for patients who are in who has substance use disorder. So to remember, mom needs methadone. So both words starts with letter M, mom methadone. So if you remember, if patient is having some substance use disorder, remember methadone, okay? So it is safe for pregnancy. However, it doesn't really withdraw the baby, but we have seen patients who undergo neonatal abstinence syndrome after delivery. So quick test taking formula, okay? Pregnant that has opioid use disorder, think of methadone or buprenorphine, overdose, withdrawal symptoms, and then relapse prevention after detox. It's also your responsibility to refer these patients for what? Rehabilitation or substance use treatment. Okay? Any questions? So look at the graphics. So why methadone? And then why? So for the board pearls, methadone is you do not taper it during pregnancy. So they stay while they're still pregnant, they still have to be in methadone, and you don't stop it abruptly, okay? Or else your patient are going to have a withdrawal. And then after delivery, the patient, when the mom asks you like, I'm pregnant, I'm taking but I want to go through treatment, so they put them on methadone, and then they will ask you what would be the risk. So one of the things that you have to educate them is potentially the baby would have some neonatal abstinence syndrome. Okay, stay till the end. We are offering discounts. All right. Are there any discounts available for review classes?
Yes, I think so.
Yes, this review is actually free. We're doing this, guys, because we want to help you pass the board exam. We need more psych providers. So we're
I agree
trying our
with you.
best.
Mental health is so much needed right now.
All right.
So
So
don't forget to, for those who are wanting a CEU out of this session, please fill out your evaluation form. Once again, you have to be registered, engaged in the whole sessions that we did this, and make sure to fill out that evaluation form. That's really a mess. To making sure that you are compliant with our requirements.
there's a question. I remember methadone had cardiac concerns. It does. However, you just don't abruptly stop medication, especially for patients of addiction, and they are pregnant, because it's gonna have like a lot of rebound side effects. However, in methadone, it's all usually small doses. So they usually work with high risk OB doctors. We call them MFM, maternal fetal medicine, and then like substance abuse professionals.
I agree with you. Do not pick options like stopping the opioids immediately.
No.
Use naltrexone as first line. Wait until after delivery or only refer to counseling. We have a scope of practice that we need to follow, and we don't want to fall into gross negligence or
Mhm.
malpractice. So we have a
Yes.
duty to do good and making sure that the patient is safe at all times.
Even as a student, can I still register for CU? Yes. Yes,
Yes.
especially if you are going to be graduating this year or next year, this is very important. More CEUs that you show to your potential employer, the higher likelihood that you will be hired. Any other questions? Okay, so we're gonna have for that question in number one, the first, so it's not a composite. Because if you look at the question, it's asking for, someone is asking, go back to our first question. Yeah, so if you look at the question, it says here during the intake assessment, the patient has history of chronic hepatitis C. So hepatitis C is a problem of the liver. A compressate is excreted through the kidneys, and it should not be given for patients with severe kidney disease. That's the difference. Much clearer? Yes. That's why the answer is antabuse. And also because a compressate is given when they're already, it's to averse abstinence after they have stopped drinking. But if you look at the question, it's asking intake assessment. So probably this patient is coming in to ask treatment so that they could stop, like, stop drinking. Yes, any RN can receive RCEUs and contact hours.
Thank you. So if you like what you're hearing right now, this is your opportunity to join our live group PMHNP last minute preparation. So this is just one day for 6 hours, which will be joined by me and Professor Leddy. So you guys saw our dynamics. We will give you tips, board tips and tricks that you guys can apply for your exam. It's gonna be on June 27, 2026, Saturday, 8 a.m. till 2 p.m. But this is California time or Pacific. So if you're in New York, then that will be 3 hours ahead. Okay, so make sure scan the QR code and type in welcome 10 for the 10% discount. So once again, we will see you for the PMHNP one day last minute prep. So these are for the students that are wanting more information about the board exam. You're ready to test within a week or so or within 90 days. That's usually what we recommend you guys. 3 months after graduation, you have to be board test ready. Okay, so we will do our best in giving you guys infographics, mnemonics, test taking strategies and tips that you guys will use and utilize during your exam.
And we're gonna share a lot of like questions that actually came out on my board exam and just like talking to my other friends who took the boards. So this will be very helpful. To be honest, when I took the exam, the first 50 questions, I was like, oh my gonna fail, it's so hard. And then I realized those were just practice questions. Those were like not scored. And when I got past 50, I was like, okay, I passed. I was that confident. And I want to make sure that you guys have the same confidence to pass the board exam in one take. So hopefully we'll see you again on our next sessions. And thank you all for joining us today.
Yeah, thank you for everything that you guys do. I know working in mental health field could be very challenging and overwhelming, and you sometimes we can feel underappreciated. But before we close, I wanted you guys to remember something very important. Passing your PMHNP board is not about knowing everything perfectly. It is about learning how to think safely, clinically, and strategically. Okay? So every question you practice is building your confidence, and every rational you review is sharpening your judgment. So every weak area you identify is not a failure, it is always a redirection. So at Past Review Center, our goal is to always help you study with purpose, answer with confidence, and walk you into the exam and knowing that you are prepared, and keep reviewing your high yield topics that we're posting every day, and keep practicing board style questions. We even have a PMHNP daily questions that we post on our social media. And most importantly, keep trusting the process. Remember, safety first, assessment first, least restrictive first, therapeutic communication, and always think like a PMHNP. Wear your hat like a psych NP. You're not anymore a registered nurse, but you're transitioning
Yes.
into an advanced practice provider role. And thank you for showing up, staying engaged, and investing in your future. We are very proud of you, and we are rooting for you, and we believe that you can pass. And that's a
Yes.
strong statement by our company. And we cannot wait to celebrate your success. And
Mhm.
now go study, stay focused, and lock it in.
Yes. There are like question. I took my board exam last February. I prepared 5 days, but I always believe that I may fail relationships, but never exams. So I'm gonna share with you guys more if you join us more on our next sessions, like the tips and tricks, like how I became so confident in taking the board exam. So I kind of gave you already an idea on the tips and tricks, like answering questions, test taking strategies, even if you don't know what the answer is. Yeah, so Johnny D. Kennel said, I graduate next year. What would you recommend that I start doing now? Start answering questions now and get familiarized because you would notice a lot of these um, questions that you might find online, especially like past review. If you follow us on all of our social media platforms,
Mm.
it highlights questions that are commonly tested in the board exam. The more you answer it, the more you get familiarized, and the more you also know what the rationale behind it. So I learn by questions. I can't spend so much time like reading thousands of pages. So I always find a way to create like mnemonics. I also created mnemonics, and which I'm gonna share for the next review sessions that we will have to remember like different stages. So I created my own. So I know a lot of people also struggled in anatomy and physiology, especially the parts of the brain, which is also heavily tested on the board exam. Yes,
Yes,
thank you
I
so
agree with you.
much.
And we have resources in our website. There are free classes. I even have my podcast on it. And also, we have question banks. We have on demand review. We call it PMHNP on demand or Flex program, question banks, and available for all of you. So once again, we're here to coach you. We're here to make you successful, and this should not be a painful process, but it should be an enjoyable process. And we have a community in our Facebook,
Mhm.
Instagram, and everything that will help you pass the exam. And we're your number one mentors here, and we're rooting for
Yes,
you. So
yes.
let's do the raffle. I think this is Amazon gift card. I hope my name is there. I'm just kidding.
Me too.
So we're gonna make sure. Thank you for all the registrants for today. Right, there you go. Right. So this is Olufonmilola Katibi. I hope I pronounced your name right. Our
Congratulations.
team will connect with you and we make sure that you get your Amazon gift card for us
All right.
as a
So
sign of your complimentary attendance for today.
make sure you do your evaluation, okay, for your free
Yes.
CEUs. And thank you so
Wow,
much
this
for
is
joining us.
yeah, this is a very good first session that we had for a live session. So we will do this more. We promise
Thank you
that.
so
A-
much. We appreciate
And
you
don't
all.
forget,
Good luck.
our book is out. There's a lot of infographics, 400 pages. So make sure we also have like mnemonics and most common high that you can use in your practice. And you can also use this in your board preparation. So 400 pages. What is an investment that you need to remember is education. Nobody
Exactly.
can take that away from you. And the Rise with Pass module and the work field. I think you had this one, Lady, before. So
Yeah,
we
that
added
one.
like a master field. So during Lady's session, we had this review with Pass module. So thank you. And thank you for all the trust and support with our program. We will see you very soon.
See you soon.
See
Have a
you,
good day, everyone.
pastors. Thank you, pastors. Thank you, Letty. Thank you,
Thank
everyone.
you.